जस्ट अ मिनट गाइस, हैंग हो गया? दिलीप जी देख लीजिए प्लीज। अभी भी बताओ अगर हैंग हो रहा है तो। यही तो स्क्रीन जा रही है इनको। तो मोस्ट कॉमन पार्ट फ्रैक्चर्ड इन ACFL, मोस्ट कॉमन पार्ट फ्रैक्चर्ड इन ACFL, मोस्ट कॉमन पार्ट फ्रैक्चर्ड इन MCFL, petrous part of the which bone? Petrous part of the so most common part fractured in MCFL, most common, okay, you cannot see me, ठीक है कोई दिक्कत नहीं है। most common part fractured in MCFL, most common part fractured in MCFL, the petrous part of the temporal bone. So the more weakest skull bone is actually the temporal bone, and the weakest part of the temporal bone is the petrous part. So it is the most common site to be fractured. Now, if I talk about clinical features, guys, in anterior cranial fossa fracture, there would be, very good, there would be CSF rhinorrhea. In ACF there would be, in ACF there would be, in ACF there would be rhinorrhea from CSF rhinorrhea, whereas in MCF there would be CSF coming out from the ear. That means CSF autoria. CSF. So CSF rhinorrhea is a feature of anterior cranial fossa fracture, and CSF autoria is a feature of middle cranial fossa fracture. कोई दिक्कत नहीं है इसमें, important, ठीक है? For CSF rhinorrhea, ENT cover करो. CSF rhinorrhea, if the patient has a traumatic CSF rhinorrhea mixed with blood, CSF is coming. So handkerchief test would be done. Which sign is seen on handkerchief test? Halo sign or target site. Halo sign or target site. So that is the clinical test. Which is the best biochemical test? Beta 2 transferrin test. Beta 2 transferrin test. Best test is beta 2 transferrin test. Okay. Overall best is also beta 2 transferrin test. Investigation of choice to localize the lesion. HRCT. Okay. याद रखना, investigation of choice to localize the lesion, then it is HRCT. ये ENT का क्वेश्चन है. Then next important question, जो पता नहीं क्यों गलत मार्क करके आए होंगे बहुत लोग. If in ACF fracture, guys, in ACF fracture, due to concussion injury, there would be discoloration around the orbit. That is a bilateral periorbital ecchymosis. Bilateral periorbital. और ये क्यों इंपॉर्टेंट है जानना? क्योंकि लास्ट टाइम क्या पूछा था? उन्होंने साइन का नाम पूछा था? नहीं, उन्होंने पूछी थी डेफिनेशन. So bilateral periorbital ecchymosis is known as which sign? It is known as which eye? Panda's eye. Or which eye? Panda's eye or? So Panda's eye recurrent eye seen in which fracture? Yeah? Panda's eye or recurrent eye sign is feature of? Panda's eye or recurrent eye is a feature of? Panda's eye or recurrent eye is a feature of anterior cranial fossa fracture. It is nothing but bilateral periorbital ecchymosis or bleeding. Then if there is bleeding or discoloration on the mastoid surface, so or in the post auricular area, ठीक है, mastoid surface ही हो गया, post auricular क्या है? So, edema important. तुम्हें जो दूसरा confusion लग रहा है ना, it is pitting edema over mastoid. That is the Grisengar site, ठीक है, not battle site. Battle site is discoloration over the mastoid surface, ठीक है, difference है. So if it is discoloration over the mastoid, it is called as discoloration over the mastoid is called as what is battle sign? And it is a feature of middle cranial fossa fracture. It is a feature of middle cranial fossa fracture. No issues with this. CSF rhinorrhea, AMCF या ECF बोलो. CSF rhinorrhea, raccoon's eye, panda's eye, CSF autoria, MCF. Battle sign, कोई दिक्कत नहीं है इसमें. In anterior cranial fossa fracture, there can be some personality changes due to frontal lobe contusion, and in middle cranial fossa fracture, there can be some memory disturbances due to temporal lobe contusion. ठीक है. Next, if I talk about skull fractures, this one is which type of a fracture? With a penetrating trauma or maybe with a hammer. This is a depressed fracture. This one is a depressed fracture. This one is a depressed fracture. It is an example of compound fracture. It is an example of. So this one is a depressed fracture. It is caused by which type of trauma? It is caused by which type of trauma? It is caused by which type of trauma? Penetrating trauma. Okay? The other one here you can see a single fracture line. This one is a linear fracture. This one is a single fracture line means a single fracture line means a. If there are multiple fractures in skull, the first fracture line will not cross the second fracture line. This is called as which rule? Repeat question है 3 बार का. इसमें भी ऑप्शन चाहिए तुम लोगों को. First fracture line does not cross the second fracture line. It is the Puppy's rule. Very good. It is the Puppy's rule. Important. Then this one, this type of a fracture, which is a dented fracture. This is a dented fracture. It is usually seen in which type of skulls? It is seen in elastic skulls of infants. It is seen in which type of skull? Elastic skulls of infants. And it is known as which fracture? Anybody? This is known as a Cone fracture. This is known as a. So elastic skulls mein which type of fracture is seen? Elastic skulls mein which type of fracture is seen? In infants, which type of fracture is seen? And Cone fracture is an example of dented fracture. Okay? Single fracture line is a linear fracture. And penetrating trauma or hammer causes depressed fracture. जो तुम बोल रहे थे gutter fracture, it is caused by glancing bullet. It is caused by glancing bullet. जो बस touch होके चली गई. ठीक है? Important. Then if I talk about facial fractures, guys. Okay, if I talk about facial upper face fractures, ठीक है? So facial fractures की बात करो. These are called as La Forte fracture. Facial fractures are called as La Forte fracture. ठीक है? So La Forte, if the fracture line passes via the maxilla, fracture line passes via the. Okay, and this is the fracture line is. Second, here also the fracture line passes via the. But this time it is pyramidal. So it is a pyramidal fracture which involves the bridge of the nose. ठीक है? So horizontal fracture line, La Forte type. Horizontal maxillary fracture, La Forte type. Pyramidal maxillary fracture, La Forte type. And here there would be chances of CSF rhinorrhea because cribriform plate would be fractured. Then, if the fracture line traverses via the orbit, if the fracture line passes via the orbit, it is La Forte type. Fracture line travels via the orbit, it is La Forte type. CSF rhinorrhea risk is seen with which two fractures? Type 2 and CSF rhinorrhea seen with type 2 and no issues with this. ENT से important है, ठीक है? याद रख लेना, ठीक है? Conservative management में जाता है if the patient has a skull fracture or even the patient has a facial fractures can be repaired, but usually the skull fractures go in conservative management. ठीक है? No issues with this. Then ठोक के ठीक नहीं करते हो तो. So याद रखना, this is important. Then if I talk about lower facial fractures, guys, lower facial fractures are what? Which fractures? Mandibular fractures. Lower facial fractures are. And which is the most common site for mandibular fracture? The most common site for mandibular fracture is. Condyle followed by. No issues with this. So most common site of mandibular fracture is usually the condyle followed by the angle of mandible. ठीक है? If there is fracture of the base of the mandible or the mentum, so if there is fracture of the mentum, usually it will cause release of which muscle? Very good. It will cause release of the. And genioglossus muscle is known as which muscle of tongue? Very good. Genioglossus muscle is known as safety muscle of tongue. One liner is changed. Which is the safety muscle of tongue? Genioglossus muscle, and it is attached to which bone? Mandibular bone. If there is a mandibular fracture, then there would be release of which muscle? Genioglossus muscle, and this can fall back. Okay, this genioglossus muscle can fall back, and that can cause obstruction, airway obstruction, causing Airway obstruction था aspiration. Respiratory distress in the patient. This type of fracture is also known as, very good, it is also known as a butterfly fracture. This is also known as a, so lower mandibular fracture is also known as a, lower mandibular fracture is also known as a, lower mandibular fracture is also known as a, lower mandibular fracture is also known as a butterfly fracture. ठीक है, known important है, ठीक है, it is known as a butterfly fracture, and it causes release of genioglossus muscle, causing respiratory distress in the patient. Next, here, easiest है, what is this? Which sign is seen on the CT scan over here? This is the, you can see protrusion of soft tissues from the orbit into the maxillary sinus, and this protrusion of soft tissues in maxillary sinus, this is known as the teardrop sign. This is known as which sign? Teardrop sign. Here you can see it is normal, okay, the orbit, but in this teardrop sign there would be fracture of the orbit. Which wall of the orbit is fractured? So this is which type of orbital fracture? Orbital blowout fracture. This is which type of fracture? This is which type of fracture? Orbital blowout fracture. And the most common wall damaged is, most common wall damaged is the inferior wall of the floor. Most common wall damage is the, most common wall damage is the, followed by the, and if there is orbital blowout fracture involving the floor of the orbit, it will cause which side? Teardrop sign. कोई issue नहीं है इसमें. Very good. शाबाश. Next, moving further. A person met with a, important for pupillary response का correct करना, शायद I said the other way round, ठीक है? So pupillary response अगर 0 है, that means both the pupils are non-reactive. Okay, both pupils are reactive. Both the pupils are reactive. ठीक है? If अगर pupillary response 1 है, one pupil is non-reactive, and अगर both pupils are non-reactive, तो हम P2 देंगे. ठीक है? Both pupils are non-reactive, तो P2 देंगे. कोई दिक्कत नहीं है इसमें. कोई दिक्कत है? A person met with a road traffic accident and was brought. A person met with a RTA, road traffic accident, and was brought to the emergency room with severe breathlessness. Okay. On examination, congested neck veins are seen, and absent air entry and absent breath sounds are noted. What is the management? First of all, tell me the diagnosis. Very good. The diagnosis is, so after a trauma, if the patient presents you with which features? A, B, C. क्या था mnemonic A, B, C? क्या? अरे भाई, मैंने जो टेंशन निमोथोरैक्स का निमोनिक दिया था वो पूछ रहा हूँ मैं. क्या बात? The mnemonic of tension pneumothorax was absent breath sounds and absent air entry on auscultation. On auscultation there would be absent breath sounds and absent air entry. ठीक है? Auscultation पे क्या होगा? Absent breath sounds and absent air entry on the affected side. B for breathlessness. B for breathlessness, and C for congested neck vein. C for congested neck vein. ठीक है? So tension pneumothorax is remembered by the mnemonic A, B, C. A for absent breath sounds and absent air entry. B for breathlessness, and C for congested neck vein. Classical features of tension pneumothorax. If I talk about the chest X-ray of tension pneumothorax, here first of all, it is due to accumulation of air in the pleural cavity, right? It is the most common cause is trauma. Here you can see on this right side or affected side, okay? Here you can see what? Increased blackening of the lungs, and increased blackening of the lungs is called as hyperlucency. Increased blackening of lungs is called as, increased blackening of lungs is called as, because air would be black on a X-ray. So hyperlucency, or sometimes also termed as hyperinflation, sometimes also termed as hyper. So two features are seen. Either there would be hyperlucency or hyperinflation. Second, this deep costophrenic angle, it is known as which sign? The deep costophrenic angle is known as which sign? Deep costophrenic angle is known as which sign? It is known as the, it is known as the deep sulcus sign. So deep costophrenic angle is known as the deep sulcus sign. No issues with this. And there would be flattening of the diaphragm due to hyperinflation. There would be flattening of the, and as the lung expand, as there is increased air on one side, the lungs would be collapse. Lungs would be collapsed. And due to this increased pressure on one side, the trachea and the mediastinum are shifted to. So trachea and mediastinum are shifted to. Trachea and mediastinum are showing. Trachea and mediastinum are showing contralateral shift. Trachea and mediastinum are showing. Trachea and mediastinum are showing. No issues with this. Important चीजें. X-ray पे जल्दी. In an X-ray of tension pneumothorax, first would be hyperlucency or hyperinflation. Second, deep costophrenic angle showing deep sulcus sign. Third, due to hyperinflation, there would be flattening of diaphragm. Due to excess air. Same side, अगर trachea is pulled towards the ipsilateral side, it is usually suggestive of fibrosis. ठीक है? Lungs constrict हो गए, and it will pull the trachea towards the side. ठीक है? No issues. If there is pleural effusion, massive pleural effusion, or there is pneumothorax, hydrothorax, pneumothorax, the trachea and mediastinum are shifted to the contralateral side. ठीक है? Ipsilateral only in case of fibrosis. In all other cases, there would be contralateral shift of trachea and mediastinum. ठीक है? समझ गए? Pneumothorax का एक्सरे इंपॉर्टेंट है और आना ही चाहिए. अगर ये नहीं आता है, that means you are making a mistake in exam. ये cherry on the cake होता है, easiest question होता है. Then procedure की मैं बात करूँ, if for management of tension pneumothorax, if the patient comes to an emergency, now here my answer will change, and I will give you a reason why my answer would change. ठीक है? Here my answer changes because they have given a history of road traffic accident. That means the patient has come after a trauma, and therefore I will follow which protocol? ATLS protocol. ठीक है? तो सर्जरी में रोड ट्रैफिक एक्सीडेंट या ट्रॉमा के बाद आता है, then I will follow ATLS protocol. अब if they have directly asked you, then definitely I will follow the medicine protocol. ठीक है? कोई दिक्कत है? हिस्ट्री हो ट्रॉमा की, then please follow the ATLS protocol. नहीं है हिस्ट्री ट्रॉमा की, follow the normal medicine protocol of Harrison. ठीक है? So in emergency condition, what is done? Needle thoracocentesis. What is the procedure called as? Needle thoraco. So emergency procedure for tension pneumothorax is? Emergency procedure for tension pneumothorax is? Wide bore needle is inserted in which space? अभी बोला मैंने ATLS protocol follow कर रहा हूँ. So now according to the recent ATLS protocol 10, ठीक है? It is to be inserted in the 5th intercostal space. It is to be inserted in the 5th intercostal space. On which line? It is inserted in the mid axillary or the anterior axillary. In between both of them, so you can remember mid axillary line. ठीक है? No issues with this. So what is the emergency procedure for tension pneumothorax? Needle thoracocentesis. Which intercostal space? 5th. Which line? Mid axillary line. If I talk about definitive management, now needle is just for temporary relief. If you need a definitive management, you need to insert a ICD, intercostal drainage tube, or a chest tube. So ICD tube insertion or intercostal drainage tube insertion is called as thoracotomy, is opening of the thorax. ठीक है? So it is actually called as ICD insertion with underwater seal. With underwater seal. ठीक है? तो याद रखना directly. अगर ये option में नहीं है, the option which contains underwater seal is to be marked as the definitive management. ठीक है? अगर underwater seal नहीं है, then you don't need to mark it as option. ठीक है? अगर कुछ नहीं है तो best answer तो वही होगा. But definitive management for tension pneumothorax is ICD insertion with definitive management for tension pneumothorax is ICD insertion with. So one end of the tube is inserted in the thoracic cavity. The other end is in the water. It will show bubbling. ठीक है? Then intercostal. Which intercostal space? Which intercostal space? Which line? So ये तुम बोल सकते हो, but usually we call it as the triangle of safety. We call it as the triangle of safety. Okay? So triangle of safety. Posteriorly it is by the lateral border of latissimus dorsi. Anteriorly it is by the lateral border of pectoralis major. Apex is formed by the base of the axilla, and base is formed by the fifth intercostal space. So usually it becomes the 4th intercostal space. So 4th या 5th intercostal space में तुम कर सकते हो. ठीक है? No issues with this. And correct placement of ICD can be identified with the help of an X-ray or a moving air column. RT का insertion का पूछा था एक बार पहले भी. So if RT tube correctly placed है या नहीं, so to verify ET tube is capnography. RT, Rice tube, it is aspiration of the gastric content. You can aspirate the gastric contents with the syringe. If you inserted a nasogastric tube, you can aspirate the gastric contents with a syringe, or you can you can auscultate on the epigastrium and push the air with the help of a syringe. You can hear a hissing sound. So अगर ये दोनों चीजें हैं, then that means the RT is correctly placed. दोनों में से कुछ भी एक कर सकते हैं. Either aspiration of gastric contents with syringe or pushing of air and auscultating on the epigastrium. ठीक है? So जल्दी से बताओ, emergency procedure for tension pneumothorax. Definitive management for tension pneumothorax. ICD insertion is done in. ICD insertion is done in. Whereas emergency needle thoracocentesis is done in which line? If it is a child, यहाँ पे आंसर चेंज होगा. Needle thoracocentesis in a child is done in second intercostal space, mid clavicular. In child it is which space? Which space? Child it is which space? Child it is which space? Which line? Which line? Then if I talk about thoracic trauma, the most common cause of mortality in thoracic trauma, most common cause of mortality in blunt thoracic trauma. Most common cause, अरे thorax रे, spleen तुम्हारा क्या होता है? Most common cause of blunt thoracic trauma. Most common cause of death or mortality in blunt thoracic trauma. Very good. It is the tracheobronchial rupture. It is the tracheobronchial. So most common cause of mortality in blunt thoracic trauma is. Most common cause of mortality or death in blunt thoracic trauma is. Most common cause of mortality in blunt thoracic trauma is. Most common cause of mortality or death in penetrating thoracic trauma is. किसकी रिवर्स thorax में होती है बता. So most common cause of mortality in penetrating thoracic trauma is massive hemothorax. Most common cause of mortality in penetrating thoracic trauma is massive hemothorax. That means accumulation of blood, and this can be removed by needle thoracocentesis or ICD tube can be inserted. Okay. Then if I talk about this one, guys, okay. So now talk about this one. If I talk about rib fracture, the most common structure which undergoes injury during the thoracic trauma, those are your ribs. Those are your ribs because they are most prominent. The most common ribs which undergoes fracture, anybody? Most common ribs to fracture are. Most common ribs to fracture are 4 to 9. On an average, you can say 3 to 5. Okay, on an average, it is 3 to 5. Okay? So 3 to 9 yaad rakho hai. 3 to 9. Okay? Third is also prone for rib fracture. No issues with this, anybody? Now, if I talk about this one, according to ATLS, a patient after RTA comes to me and there are multiple fractures. Okay, so almost more than 2 fractures in more than 2 consecutive ribs. It is known as a flail chest. This is known as a flail chest. So what is a flail chest? Fracture of how many ribs? Fracture of more than equal to ATLS के according 2, Bailey के according 3. ठीक है? So fracture of how many ribs? More than equal to 2 ribs. More than equal to 2 ribs. In more than equal fracture of more than equal to 2 ribs in more than equal to 2 consecutive places. More than equal to 2 consecutive places. No issues with this, anybody? So 4th, 5th rib is fractured. Okay? So 2 consecutive ribs at 2 or more sides. At 2 or more sides. That is what is a flail chest. Okay? Multiple rib fractures. Minimum 2 rib fractured है. More minimum 2 places पे है. Consecutive है मतलब 4th, 5th, 5th, 6th ऐसी है. Then it is a flail chest. And here the breathing would be not in synchrony. Asynchronous breathing is seen in flail chest. This is known as paradoxical breathing. This is known. Paradoxical breathing is a feature of flail chest. No issues with this, anybody? Then if I talk about management of flail chest or rib fracture, repair करोगे ना? So rib fractures go conservative management. Rib fractures go for conservative management. What is given only? Analgesics are given. What is given? Analgesics are given. Okay, that is for relief of pain. For rib fracture, normal rib fracture, we can give oral analgesics or oral painkillers. But for flail chest, we need to give epidural analgesia. For flail chest, we need to give epidural analgesia in the thorax. Okay? Whereas, along with that, we can give oxygen supplementation. And this is given by which mechanism of ventilation? IPPV, that is intermittent positive pressure ventilation. Oxygen is given by intermittent positive pressure ventilation. No issues with this. Yaad rakhna. So which two things are done in cases of flail chest? First is epidural analgesia and second is IPPV. Second is IPPV. कोई दिक्कत नहीं है. If the patient does not improve, risk अगर किसी और organ को injury है, pulmonary contusion है, then that is an indication to open the thorax, thoracotomy and repair. Otherwise, the patient would not be treated. Ribs will unite on their own. ठीक है? Displaced fractures, बहुत ज़्यादा displaced, मैं वही बता रहा हूँ. अगर बहुत ज़्यादा displaced fractures है, तो ही हम जाते हैं इसमें surgical management. ठीक है? So those are the indications for surgery. Otherwise, it goes in conservative management. Then if I talk about और wiring करी जाती है, tension band wiring. Next, what is this image? You'll ask examiner. Very good. This is a cardiac tamponade. So what do we mean by cardiac tamponade? Anybody? What do we mean by cardiac tamponade? Massive pericardial effusion. Means if there is excessive pericardial effusion in the pericardial cavity, it can be due to a fluid or it can be due to blood accumulation. Okay? So massive fluid accumulation or massive blood accumulation in the pericardial cavity is called as cardiac tamponade. Which triad is seen in cardiac tamponade? Which triad is seen? Which triad is seen? Next triad. First feature is muffled heart sound. So on auscultation, see, other features would be same in pneumothorax and cardiac tamponade. Okay, only two features will help you differentiate. First, on auscultation, in tension pneumothorax there would be absent breath sounds and absent air entry. In cardiac tamponade there would be muffled heart sounds, muffled S1 and muffled S2. Okay. Second feature, percussion. Okay. On percussion in pneumothorax there would be which note? There would be which kind of note? Hyper resonant note. Which kind of note? Which kind of note is seen? Hyper resonance is seen. Hyper resonance is seen. But in cases of cardiac tamponade, what is seen? Dull note is seen on percussion. Which kind of note is seen? Dull note is seen on percussion. No issues with this, anybody? ये समझ गया तो ये important याद है. So birth strike का first feature is muffled heart sound. Second feature is raised JVP. Pulsatile or non-pulsatile? Only place where there would be non-pulsatile elevated JVP. अभी भी गलतियां कर रहे हो यार. Question भी डाला था Telegram group में. So raised non-pulsatile JVP is seen in cardiac tamponade. Raised non-pulsatile JVP is seen in cardiac tamponade. SVC syndrome and cardiac tamponade बताया था. उसमें non-pulsatile होता है. बाकी सब conditions में there is a pulsatile elevated JVP. And the third is hypotension due to compression of the inferior and superior vena cava, decreased venous return, decreased the cardiac output, decreased blood pressure. ठीक है? So three features of bed strike. जल्दी से first is second is and third is. Then if I talk about management, emergency management of cardiac tamponade is done by emergency management is done by needle pericardio. Emergency management is done by needle pericardio. Emergency management is done by needle pericardio. ठीक है? Needle pericardio synthesis beneath the Zephyr sternum. ठीक है? And definitive management is done by surgical management. That is क्या? Thoracotomy. Definitive management is done by. We will open up the thorax. ठीक है? So emergency management of cardiac tamponade. Definitive management of cardiac tamponade. Thoracotomy. No issues with this. चलो आगे चलते. A patient presents with blunt abdominal trauma. आ गए इस पे. Shock index is less than 1. So I hope all of you are quite aware what is the shock index. Shock index is calculated as anybody? Heart rate upon. पहले it was systolic blood pressure. Now it is mean arterial pressure. Okay, you can even take systolic blood pressure also. ठीक है? So what is the normal heart rate? Normal heart rate is 75. Systolic blood pressure normally is 120. So normal shock index should be less than 1. But in cases of hemodynamic instability, that means when the patient was in shock, the shock index would be why? Because the systolic blood pressure will fall or the mean arterial pressure will fall, and second, the heart rate would increase. That would be reflex tachycardia. ठीक है? So systolic blood pressure 90 हो गया, heart rate 120 हो गया. So the shock index is more than 1. So hemodynamic stability, shock index less than 1. Hemodynamic instability, shock index more than 1. ठीक है? So here they have said that the patient has a shock index of less than 1. That means the patient is hemodynamically stable. And he has pain which is referring to the left shoulder. So pain referring to the left shoulder on extending the left leg. It is called as which sign? It is known as the Keher sign. Very good. It is known as the Keher sign. This is known as the Keher sign. So Keher sign, or the other one is the balances sign. These are features of which injury? So blunt abdominal trauma, the most common organ injured is blunt abdominal trauma. Most common organ injured is spleen. Okay, here therefore there would be splenic injury, and the sign of splenic injury is Keher sign or balances sign. Signs of splenic injury are Keher sign or balances sign. So referred pain to shoulder, left shoulder tip, it is known as Keher sign, and shifting dullness absent, it is known as balances sign. No issues with this. These are features of splenic injury. Okay. Now, please let me know in splenic injury if the patient is hemodynamically stable. What is the next step to be done? Very good. Fast या e-fast? Abdominal trauma. तो अगर e-fast है तो बहुत सही है. But otherwise, the investigation of choice would be if a patient, ये याद रखो, कुछ books बोलती है if investigation of choice hemodynamically stable है तो CCT, hemodynamically unstable है तो fast. ठीक है? But usually बहुत सारे books जो है investigation of choice, either the patient is hemodynamically unstable or stable, they give you the one answer, and that is fast. What do we mean by fast? Focus assessment by sonogram and trauma. So ultrasound is done, and there are how many probes or how many passes? Normal pass के कितने passes? Which passes? Jaldi. First is the epigastric pass. And it is to look for the pericardial cavity, to look for any cardiac tamponade. Second is the in the right hypochondrium. It is known as the perihepatic pass. Second is the perihepatic pass to assess any liver injury. Third is the left hypochondrium. It is the perisplenic pass. And fourth one, pelvic pass. Fourth one is the pelvic pass. No issues with this. Jaldi say the four passes in fast. First is, second is, third is, fourth is. If I talk about e-fast, that means the extended fast. It is usually done in cases of thoracic trauma. Okay, in thoracic trauma to assess hemothorax. So two more passes would be added. Those would be right and left thoracic passes. The two more passes added are right and left passes. No issues with this, anybody? Jaldi se na. Investigation of choice is fast, but the gold standard investigation would be if the patient is hemodynamically stable है. तो याद रखना, if the patient is hemodynamically unstable or stable, investigation of choice is fast or e-fast. Okay. Whereas if the patient is hemodynamically stable, maintain कर सकता है, then you will further go for CCT. Okay, for better resolution. But if the patient is hemodynamically unstable, BP is crashing, then you will directly perform exploratory laparotomy. Then you will perform definitive management, that is exploratory laparotomy. And in cases of splenic injury, after exploratory laparotomy, what should be done? अरे यहाँ पे पेशेंट स्टेबल है, मतलब स्प्लेनिक इंजरी इतनी नहीं हुई है, तो काहे उसकी स्प्लीन निकाल रहे हो बच्चों? So exploratory laparotomy along with repair of spleen, that is what is called as splenography. That is called as splenography. If the spleen is damaged, grade 4 or grade 5 splenic injury, then here you will perform splenic. समझे? grade 1, grade 2 या grade 3 splenic injury, treatment is splenography. treatment is splenography. But grade 4 or grade 5 splenic injury, treatment is splenectomy. Grade 4 or grade 5 splenic injury, treatment is splenectomy. ठीक है? And it is usually done after exploratory laparotomy. ठीक है? No issues with this. Now, most common organ injured in blunt abdominal trauma. Most common organ injured in blunt abdominal trauma is followed by आगे भी बोलो, followed by small intestine, followed by small intestine, followed by the most common organ injured in blunt abdominal trauma. First is, second is, third is in penetrating abdominal trauma, chakul. The most common organ injured is followed by small intestine, followed by diaphragm. We याद नहीं रहा था तो चलो. Penetrating abdominal trauma, most common organ injured. First is, second is most common organ injured in seat belt trauma. It is the mesentery. Mesenteric rupture होता है. So most common organ injured in seat belt trauma is mesentery. Sorry, most common organ injured, abdominal organ injured in gunshot wound. It is the small intestine. Most common organ injured in gunshot wound is most common organ injured in blast injury. This is not only limited to abdominal, किसी का भी बता सकते हो. So most common is tympanic membrane. So the most common organ injured in blast injury is followed by नीचे आओ, air filled cavity, then followed by small intestine. ठीक है? So the most common organ injured in blast injuries. First is, second is, third is, fourth is, fifth is, shaft pass. Moving further. Now, if I talk about this one, if there is a liver injury, what should be done? First of all, liver injury means there would be excessive bleeding, and therefore you need to perform a fast first of all to diagnose. Fast में if there is a positive fast, perihepatic abscess या फिर perihepatic accumulation of blood दिखता है, then you will perform a exploratory laparotomy. And what is the maneuver performed? Anybody? Very good. For liver injury we perform a. This was asked. We perform a Pringles maneuver. We compress which ligament? We compress the portal triad. Portal vein, hepatic artery, and the bile duct. Okay. So mainly it is we will compress the portal vein and the hepatic artery, which will stop the bleeding. So which maneuver is performed in liver injury? Then this was a question from August. Retroperitoneum zones of injury. Now here, if a patient has a penetrating or a blunt abdominal trauma, zone 1 is the central zone. Zone 2 is the lateral or the peripheral zone. Zone 3 is the, and the question was, if a patient sustains a abdominal trauma, which zone needs exploration? Always and always. Which zone needs exploration? Because it contains major blood vessels like aorta and inferior vena cava. So always and always exploration would be required by zone 1. Zone 2 and 3, they will first of all require more observation and monitoring. But if the patient BP is crashing, hemodynamic instability, then we will do exploration. Otherwise only observation and monitoring. For zone 2 and 3 observation and if it is a penetrating trauma, definitely in any zone it would be exploration. If it is a penetrating trauma, any zone it would be exploration. No issues with this. Blunt mein zone 1 needs exploration. Zone 2 and 3 needs observation and monitoring. Blunt abdominal trauma दिया था August में, they have asked you 2 zones. हमें एक option था ही नहीं. Zone 1, Zone 2, Zone 1, Zone 3, Zone 2, Zone 3, none of the above. Sorry, all of the above. So what would be your answer for blunt abdominal trauma? Which 2 zones will require absolute exploration always? 1 and 3. Pelvic में ज़्यादा blood loss होता है, सुना होगा. ठीक है? तो pelvis में iliac arteries होती है, and therefore there is a high blood loss. Peripheral zone में small renal arteries होंगी, उनमें इतना blood loss नहीं होगा. Pelvis में iliac arteries होती है तुम्हारी, and therefore it needs zone 1 and 3. Gunshot injury, it is the small intestine. No issues with this. Now if I talk about neck zones, ठीक है, तो neck zones भी important होते हैं. Here first neck zone is from the sternal notch. First zone is from the sternal notch to the cricoid cartilage. Sternal notch to the cricoid cartilage. Second is from the cricoid cartilage to the angle of mandible. Zone 2 is from the cricoid cartilage to the angle of mandible. And zone 3 is from angle of mandible to the base of skull. Zone 3 is from angle of mandible to the base of skull. High maximum mortality would be seen in zone 1. Maximum mortality important structures होते हैं zone 1 में. ठीक है, so maximum mortality अगर वो पूछे it is zone 1. Maximum mortality is zone 1. Which zone will require exploration always and always? Which zone will require exploration always and always? So it is zone 2 because it contains major blood vessels, and also zone 1 at times. ठीक है, so zone 1 and zone 2 will require exploration in this patient. ठीक है, no issues with this. So exploration अगर वो पूछे तो zone 1 and zone exploration is required for zone 1 and zone. कोई दिक्कत नहीं है. Moving further, talking about burns. Now if I talk about burns, guys, the most common overall burns are scalds due to moist heat. चाय गर्म पानी किसी से भी. The most common overall burns are most common hospital burns are flame burns. Most common hospital burns are most common cold burns are frostbite. Most common cold burns are and in frostbite, here you can see there would be formation of ice crystals within the tissue. Along with that, the blood supply would be impaired to the part, and therefore the fingers will have gangrene. There would be bluish discoloration which can further progress to gangrene. So two important features. First of all, there is formation of ice crystals, and second there would be ischemia, causing what? Causing gangrene in the patient. And what should be done for frostbite? Anybody? What should be done? So gradual warming is done, not rapid rewarming. It is a gradual rewarming. Which kind of rewarming is done? Gradual rewarming is done. Okay, important. And if the fingers have already lost the blood supply and gangrene has already started, then you will wait till the demarcation line appears, and then you will amputate. Okay, amputation means removal. No issues with this, anybody? So frostbite समझ गए? The other can be due to moist water, moist cold or water की वजह से. क्या होता है forensic में? Trench foot. It is the trench foot. No issues with this, anybody? Now, please let me know if I talk about burns first. So burns can be either first degree, second degree, third degree, or fourth degree burn. First degree burns, what is damage? Epidermis. First degree burn. So there would be redness, there would be swelling, and there would be pain in this patient, right? And so here this is the first degree burn. Okay, redness, swelling, and pain. Second degree can be divided as superficial second degree burns or So superficial second degree burns में what is damage? Epidermis and papillary dermis. Epidermis and papillary, that is a superficial dermis. ठीक है? Here there would be reddening, pain would be there. But important feature is so blisters are seen in which degree burn? To be specific, second degree. Superficial. ठीक है? Deep में ज़्यादा deep burns होता है. ठीक है? Second degree deep burns. Here there would be pallor, blisters along with pain, and there will be damage of epidermis plus complete dermis. Epidermis plus complete dermis. ठीक है? ये थोड़ा अलग है. So here there would be formation of pallor, blister, and pain. Grade 3 burns are usually damage of epidermis and subcutaneous tissue. Damage of epidermis, dermis, and subcutaneous tissue. Third degree are damage to dermis, epidermis, subcutaneous tissue. Third degree are damage to epidermis, dermis, subcutaneous tissue. ठीक है? Here there would be formation of a thickened skin, which is a leather-like style. So this leather-like fibrotic scar which is formed. So this leather-like fibrotic scar, it is known as. So leather-like fibrotic scar is known as. And scar is formed in which degree burn? Blisters are formed in which degree burn? Second degree burns. No issues with this. What is the treatment for scar? It can compress and cause respiratory distress. So the treatment would be giving multiple cuts, that is escarotomy. So this question was asked. What is the treatment of choice for scar? Escarotomy. What is the treatment of choice for scar? Escarotomy. No issues with this. Next, grade 4 burns are usually damage to the epidermis, dermis, subcutaneous tissue, and to the adjacent structure, muscles, bone, tendon, ligament, blood vessels, nerves, everything. Okay? So this would be your grade 4 burns. Okay? Now please tell me, grade 1 were painful or painless? Grade 2 were painful or painless? But grade 3 and grade 4 are? Grade 3 and grade 4 are? Grade 3 and grade 4 are? Because due to destruction of the nerve endings. ठीक है? No issues with this. याद रखना. कोई issue है इसमें? Yes, में grade 2 deep ना उसमें हो सकता है. If the nerve endings are damaged, it can also be a painless burn. Okay? It can also be a painless burn, but sometimes pain can be seen. अब it depends कितना structure affected है और कितना. ठीक है? Now, but yeah. Scars are usually first degree burns. क्योंकि देखो important है, redness होता है, swelling होती है, pain होता है. That's it. So that is first degree burn. Scarred is a first degree burn. No issues with this. Now I talk about burns में. Most common cause of death. Most common cause of immediate death in burns. Most common cause of immediate death in burns is. Most common cause of immediate death in burns is. Most common cause of immediate death in burns is. Followed by neurogenic shock. Followed by the most common cause of immediate death in burns is. Followed by most common cause of immediate death in burns is. Followed by most common cause of early death in burns is. That means within 3 days of burns, the most common cause of death would be. Most common cause of early death in burns is. Most common cause of early death in burns is. Most common cause of late death in burns is. Most common cause of late death in burns is. That means infection of the burn wound. That will cause sepsis in the patient. Okay? If I ask you most common only after I ask you most common cause of burn. Sorry, most common cause of death in burns. Most common cause of death in burns is. Most common cause of death in burns is. Most common cause of death in burns is. Most common organism responsible for sepsis. Most common organism responsible for sepsis is. Most common organism responsible for sepsis is. Most common source of sepsis is. Sean? Most common source of sepsis is burn wound itself. Most common cause of sepsis. Most common source of sepsis is. Most common source of infection is burn wound. वहीं से infection अंदर जाता है. ठीक है? Then a person was stuck in his cabin. याद रख लो, important question. A person was stuck in his cabin when it caught fire. He was rescued by firefighters, but was brought in unconscious state to the emergency room. What is the most important step in management? So he was stuck in a cabin. That means an enclosed room. So the room was closed, right? Or if the patient was brought to you and the patient was having respiratory distress. Third, if there was signing or burning of the nasal hair, any burns involving the face, head or the neck, any burns involving the face, head or the neck, you will suspect which kind of burn? Inhalational burn. You will suspect which kind of burn? So here what is the diagnosis? Which is the diagnosis? Or black soot particles in the sputum. Black soot particles in the sputum. Or are suggestive of. So black carbon or soot particles in the sputum are also suggestive of inhalational burns. And the most common cause of death would be asphyxia in the patient. Okay. So what is the most important step in inhalational burns? Anybody? Early. So in inhalational burns, there can be a risk of laryngeal edema, and then the intubation can become difficult. So the most important next step would be early intubation. The most important next step is early. The most important step is early. याद रखना ये, ठीक है? No issues. Acute epiglottitis may be same. If they ask you the most important next step in inhalational burns also, the answer is early intubation. The answer is early intubation. All of these are signs of inhalational burns, and the patient has to be admitted. Otherwise, when the patient is admitted, how much total body surface area of burns is required to admit the patient? In adults, more than 10%. In adults, more than 10%. Sorry, in adults, more than 15%. Adults more than 15%. Children more than 10%. It is a criteria for admission. A 30-year-old male was caught in the fire and brought to the emergency room. Doctor for assessment of total body surface area of burn used the Wallace's rule of 9. His both upper limbs and the thorax was charred. That means burned. So the thorax was charred anteriorly as well as post. The total body surface area involved. So jaldi se karte hain. So the commonest rule that we use for assessment of total body surface area of burn is the Wallace's rule of 9 or the Alexander Wallace's rule of 9. So here head and neck would be anterior chest is upper back, lower back, abdomen, perineum, important. Each leg is 18. Each leg anteriorly 9, posteriorly 9. So each leg would be. ठीक है, याद रखना. Then we also have in Wallace's rule of 9 in children usually the head and neck. If it is used in children, Wallace's rule of 9. So if a child is at 1 year of age, then the head and neck will constitute. But each lower limb will constitute 13.5%. Each lower limb will constitute 13.5%. As you go from 1 year till 9 years of age, you will increase 0.5 in lower limb and decrease 1% from head and neck. You will decrease 1% from head and neck, and you will add 0.5 in lower limb. Till what age? Till 9 years of age. No issues. नहीं याद रहता, at least main adult वाला याद रखो, ठीक है? And which is the best total body surface area assessment के लिए chart? These are your Lund and Browder charts. The best charts used are Lund and Browder charts. ये कुछ नहीं पूछेगा. And then if they say the patient is having patchy burn, then we can use which rule? Patchy burns के लिए भी use the patchy burns के लिए भी use the palm rule. And किसका palm? तुम्हारा है, patient का. So patient's palm. One palm will constitute 1% of the total body surface area. No issues with this. Now here please let me know the answer. Both upper limbs are charged. That means 9 plus 9, 18%. Thorax was charged anteriorly plus 9%. And it was also charged posteriorly plus 9%. 9 for the 36. So the total body surface area involved is, would be 36%. No issues with this. Next, if I talk about management in patient of burns, what should be done? पहले तो ये burns patient का बताओ जल्दी. Grade 1 के लिए we will do. Grade 1 के लिए exposure. Grade 1 के लिए. Grade 2 के लिए dressing. Grade 2 के लिए. And the most common agent used for dressing is 1% silver sulfadiazine. Important side, most important disadvantage of sulfadiazine, it cannot penetrate the therefore an agent which can penetrate the eschar, it is known as 5% mafenide acetate. But it causes pain. Okay, most commonly used for dressing is, for eschar we use mafenide acetate. No issues with this. Then moving further, management apart from that, and for 3rd and 4th degree burns we will require for 3rd and 4th degree we will require skin grafting. Definitely the initial management would be resuscitation, which is followed by the ABC, airway, breathing, circulation, disability management, and lastly exposure. E for exposure. Okay? Along with that, we need to give the patient IV fluids. Which IV fluid is used? Crystalloids or colloids? So the best fluid to be used is, so these are crystalloids, and which crystalloid is best? Normal saline or ring lactate? The best crystalloid to be used is the best crystalloid to be used in a burns patient is, the best crystalloid to be used in burns patient is ringer lactate. कोई दिक्कत नहीं है इसमें, important. Then जहाँ पे definitive management for first degree it is, बता दो जल्दी. Exposure for second degree it was, with which agent? Silver sulfur diazine. Or the for ASCAR we can use mafenide acetate. Cerium nitrate is the best one. वो याद नहीं रहेगा तो. Third degree we will do. Third and fourth degree. The best skin graft is taken from best skin bone grafting के आंसर दे रहे हो ना, शाबाश. Worst bone graft is taken from iliac crest. ठीक है, best skin graft is taken. If you need a partial thickness skin graft, then it is to be taken from thigh. The best partial thickness graft can be taken from thigh, anteromedial or anterolateral thigh. Whereas the full thickness graft is taken from supraclavicular area. It is taken from supraclavicular area or the post auricular area ठीक है. Full thickness from supraclavicular or post auricular or partial thickness from partial thickness graft के लिए which instrument is used? Humvee knife. Full thickness graft के लिए which instrument is used? Wolfie's blade. And electrical is electrical dermatome. Then usually after in a burns patient, physiotherapy started on first day. But in cases of skin grafting, it should be started after 5 days, because the time taken for settlement of skin graft is the physiotherapy after 5 days. No issues with this, anybody? Shabash. Moving further, a child 20 kg was brought to you with burns and fluid resuscitation was to be started in this child. Okay? The total body surface area of burns involved is 30%. Calculate the fluid requirement according to the Parkland formula. So for fluid requirement, we need a Parkland formula. Parkland formula क्या है? 4 into important. Parkland formula is 4 into weight in kilograms into total body surface area of burn. Will give you the volume in ml. Will give you the fluid volume in ml. यहाँ पे 4 into weight कितना है? Weight is total body surface area affected is, so the amount required is 2400 ना. So the total amount is भाई मैं खुद पे डाउट करने लगा हूँ. 240. So the total amount of fluid required is 2400 ml. समझ गए? What is the formula for Parkland? 4 into weight in kg into total body surface area. ठीक है? Out of this volume, half should be given within. The next half should be given within. So this total volume is for how many hours? So this total volume is for 24 hours. Which fluid? Crystalloid. Which crystalloid? Ringer lactate to be given. No issue. If they ask you according to ATLS protocol, child में है, definitely, very good. So in adults we only give a ringer lactate solution, but in children, for usually here we can give for nutrition we can add 5% dextrose. In child we can add 5% dextrose. ATLS protocol के according, what is the formula? Jaldi. Adult it is 2 into body weight into total body surface area of burns. ये question आ चुका है और सबने Parkland use करा था. ATLS if they mention, the formula is 2 into body weight into total body surface area of burns. This is for if they say about children, then the multiplier would be 3 into body weight into total body surface area of burns. And if they say if there is a electrical injury, then it is, if it is an electrical injury it is ठीक है. इलेक्ट्रिकल इंजरीज कैन बी आइदर लो वोल्टेज इलेक्ट्रिकल बर्न और हाई वोल्टेज बर्न. लो वोल्टेज आर कॉल्ड एज जूल बर्न. लो वोल्टेज आर कॉल्ड एज जूल बर्न. हाई वोल्टेज आर यूजुअली ड्यू टू एसी करंट, क्रोकोडाइल बर्न. दीज आर कॉल्ड एज क्रोकोडाइल बर्न. लाइटनिंग अगर होती है, it is known as filigree burn, also known as arborizing pattern or burning pattern. ठीक है. Calculate the maintenance fluid. So this was the resuscitation fluid which was given. For maintenance fluid to be given in this case, child कितना weight है? 20 kg. What is the formula for maintenance fluid? First 10 kg, 100 ml per kg. First 10 kg, next 10 kg, next 10 kg, 50 ml per kg. Next 10 kg, and next over 10 kg it would be, over 20 kg it would be, over 20 kg it would be 20 ml per kg. 20 ml per kg. तो यहाँ पे अपना बच्चा कितने वेट का था? So the child was 20 kg. So for first 10 kg it would be 100 into 10, that is 100 into 10, that is for next 10 kg it would be 100 into, oh sorry, 50 into 10, 500 ml. So the total maintenance fluid should be given as, the total maintenance fluid to be given as 1500 ml. कोई दिक्कत नहीं है इसमें. First 10 kg, first 10 kg, next 10 kg, next 10 kg, more than 20 kg, 20 ml per kg. Moving further. Breast, जितना हो सकता है मैं cover करूंगा. Breast, a lady presents to you with breast lump. What will be the best approach for assessment? Very good. The best approach for assessment is, the best approach for assessment is, the best approach for assessment of a breast lump is triple assessment. The best approach is triple assessment. And triple assessment में तीन चीजें करेंगे. First is clinical examination. First is clinical, along with history, along with, so first to be done is clinical examination along with history. Second one is radiological investigation. Second one is radiological investigation. If the patient is less than 40, it is ultrasound. Patient less than 40, patient less than 40, patient more than 40, patient more than 40. Third would be histopathological examination. Less than 35 कुछ बुक्स बोलती है, बीरी बोलते less than 40. यार 40 याद रख लो, 35 याद रख, 35 याद रख सकते हो तुम. Previously less, जो मैंने पहले दिया था, less than 35 it was ultrasound, more than 40 more than 35 it was mammography. ठीक है. बट अगर breast तो भी dense है till 40 years of age, then तुम्हें ultrasound यूज करना पड़ेगा. ठीक है. So it is usually used for the dense breast tissue. जल्दी. Third is histopathological examination. Biopsy means first is FNSC. First is FNSC, or it can be a true cut biopsy. Second would be a true cut biopsy. So triple assessment में तीन चीजें करते हैं. First is along with, second is radiological investigation. Less than 35, less than 40 is young patient is, old patient is histopathological examination. First is, second is, then if I talk about screening test of choice, ठीक है, ये पूछा जाता है. If the patient presents to you with breast lump, or even prior to that, if the patient has a history of breast cancer in the family, or there is gene mutation in that patient, ठीक है, so breast screening test should be started. So which is the best screening test to be used in a female less than 40 years of age? So ये देखो, रोहन सर के नोट्स में 40 है, विनीत सर के नोट्स में 35 है, बाकी उनके नोट्स जस्ट सर ने कितना लिखा? 30. या till 35 till 40 dense होता है breast tissue. Till 35 till 40 breast होता है dense tissue because the female is still in the reproductive age group. ठीक है. So usually less than 40 में बोल दो, less than 40 it is, बोलो, less than 40 it is, less than 40 it is, because the breast tissue would be dense. More than 40 it is, more than 40 it is, more than 40 it is mammography. Okay, pregnant female, pregnant female, pregnant female, pregnant female with breast, sorry, female with breast implant, female with breast implant, female with breast implant, high risk female, high risk female, high risk female means the female having history of family, history of breast cancer in the family, or maybe BRCA1 or BRCA2 gene mutation. ठीक है. Next, if I talk about risk factors, what are the risk factors of breast cancer? So breast cancer would develop due, it is a hormonal dependent cancer. It develops due to which hormone? Mainly estrogen. So when there would be hyperestrogenicity. Hyperestrogenicity would be seen when the menarche and menopause, because that will increase the reproductive lifespan and exposure to estrogen in the patient. Pregnancy is protective or risk factor? Pregnancy is protective. Lactation is protective or risk factor? Lactation is protective, again important, okay? Because that gives a break from estrogen in the period, okay? Then smoking is protective or risk factor? Smoking is a risk factor usually in younger females. Then again alcohol, okay? All of these are risk factors. Apart from that, obesity, because obesity may more production of estrogens would be there, okay? And all other gene mutations, whatever they are, all of these are important risk factors, okay? So early menarche, menopause, smoking, alcohol and obesity, okay? And one more important, pregnant nahi hui kabhi, that is nulliparity is a risk factor or a nulli gravida, whatever you call it. Most common site for breast cancer is a breast lump. Most common site for breast lump is upper. Most common site for breast lump is upper outer quadrant. Most common site is upper outer quadrant. Whereas least common site is ulta, lower inner quadrant. Least common is lower inner quadrant. Now, most common type of breast cancer is ductal cancer. DCI is invasive. Most common type is invasive ductal cancer. Most common type is invasive ductal cancer. No issues with this. Now please tell me, breast cancer is more commonly sporadic or familial? Shabash. Only 10 to 20%, 10 to 15% cases of breast cancer are familial or genetic. ठीक है? BRCA1 ज़्यादा सुनते हो, that does not mean breast cancer is more commonly genetic. Breast cancer is more commonly sporadic. Breast cancer is more commonly sporadic or less commonly familial or hereditary. In sporadic, which gene mutation is seen? Sporadic, you can see P53. Sporadic, you can see most common gene implicated in all malignancies of body is. So sporadic, you can see P53. Familial, you can see BRCA1 and familial, you can see BRCA1 and BRCA2. BRCA1 on chromosome number. BRCA2 on chromosome number. BRCA2 on chromosome number. E-1 2. ठीक है, ऐसे याद रख सकते हो. Important. So BRCA1 or BRCA2 gene mutation can cause familial or genetic hereditary breast cancer, which will run in the family. ठीक है. Most common out of these two is. Whereas in male breast cancer, most common is incidence of male breast cancer out of 100 is only 1%. Site is again the upper outer quadrant over there as well. ठीक है? If I talk about the staging of breast cancer, important है, याद रख लो, बस important चीजें बता रहा हूँ. T1, that means less than. T1 means less than. ठीक है, कहाँ से? T1 is less than equal to. T1 is less than equal to. T2 is 22. T2 is T2. T2 is 22. So more than 2, less than equal to 5 centimeter. T3 is more than. T4A is extension to the chest wall. T4A is extension to the. T4B is extension to the. T4B is extension to the. T4C is both. T4C is skin plus chest wall plus skin. T4D is inflammatory. T4D is जल्दी से करेंगे. T1 T1, T2, 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 T3, T3, T4A, T4A, T4B, T4B, T4C, T4B, T4C, and T4D, T4D. Worst prognosis, worst prognosis, worst prognosis, inflammatory breast cancer. Nodal metastasis अगर याद नहीं रहता है तो छोड़ सकते हो, but if you can remember, N1A ipsilateral 1 to 3 axillary lymph node, N1B internal mammary lymph node, N1C axillary lymph nodes along with internal mammary lymph nodes. So N1C is no issues with this. N2A 4 to 9 axillary lymph nodes, N2B internal mammary lymph nodes, N2B internal mammary lymph nodes, but without axillary lymph nodes. N3A more than 10 axillary lymph nodes. N3A more than 10 axillary lymph nodes or infraclavicular. N3A is infraclavicular. N3C is supra. N3C is supra, and N3B would be, it is सब याद रख लो mixture, internal mammary axillary सब कुछ, ठीक है. So जल्दी से N1A ipsilateral axillary, N1A ipsilateral, N1B ipsilateral internal mammary, N1B ipsilateral, N1C 1 to 3 axillary and N1C both, N1C, N2A 4 to 9 axillary, N2A 4 to 9 axillary, N2B internal mammary, N2B internal mammary without axillary, N3A more than 10 axillary or intraclavicular, N3B all, and N3C supraclavicular. How many groups of axillary lymph nodes are there? So 90% of the lymph flow from breast goes to the axillary lymph nodes, 10% to the internal mammary. Okay, so sentinel lymph nodes for breast are the first draining lymph nodes of a cancer are called as sentinel lymph nodes. Those are axillary for breast cancer. Now please tell me how many groups, anatomical groups कितने होते हैं? 5 anatomical groups are capilla is the mnemonic. ठीक है, अगर याद रखना. And how many levels? 3 levels. How many levels? Surgical levels कितनी होती है? The surgical levels are in relation to the pectoralis, minor muscle. ठीक है, तो level 1 is lateral, level 1 is, level 2 is behind, level 2 is, and level 3 is medial, level 3 is medial. तो L पहले आता है, M बाद में आता है, तो L1 M3. ठीक है, तो ऐसे याद रख सकते हो अगर याद रखना. Now please tell me what is this appearance called as? This appearance is called as and purely orange. It is due to obstruction of subdermal lymphatics. It is due to obstruction of subdermal. Please tell me, can it be calculated in skin involvement or not? So skin involvement में 2 features होंगे. Either it is the purely orange appearance or satellite nodules. Purely orange appearance or the satellite nodules. ठीक है? And it is due to obstruction of subdermal lymphatics. Nipple retraction, as you can see, it is due to constriction of the lactiferous duct. Will it be counted in skin involvement? No. याद रखना, nipple retraction is or dimpling of skin is not counted into skin involvement. Dimpling of skin is due to involvement of ligament of Cooper. Dimpling of skin is due to involvement of ligament of Cooper. So obstruction of subdermal lymphatics is known as So here the breast wall is appearing like a orange peel, and it would be T4. Then if they ask you what is this, this is called as cancer and curious. This is called as cancer and and it is due to obstruction of, very good, this is due to obstruction of cutaneous lymphatics. This is due to obstruction of subdermal lymphatics, obstruction of cutaneous lymphatics, cancer and curex. This can also be calculated as skin involvement. ठीक है? Cancer in curex, satellite nodules या PUD orange, but no dimpling of skin, no retraction of nipple. And if I talk about metastasis from breast cancer, the most common site of metastasis would be bones. In bones, the most common site of vertebra. Which vertebra? So the most common site would be lumbar, followed by thoracic vertebra. And this metastasis is lymphatic or hematogenous. It occurs via which plexus of veins? It occurs via Patterson's plexus of veins. Which plexus of veins? It occurs via which plexus of veins? So Patterson's plexus of veins से दो cancers metastasize होते हैं to the vertebra. First is the breast cancer. Second one is the in males prostate cancer. So two cancers metastasize to the vertebra with the help of Patterson's plexus of veins. In female it is in males it is the prostate cancer. And usually in breast, lumbar vertebra is the most common site of metastasis. Hematogenous route of spread is there via the Patterson's plexus of veins. Okay, and which kind of metastasis is seen? Osteoblastic, osteolytic mainly. Mainly it is the osteoblastic metastasis is seen in prostate cancer. Osteoblastic is seen in यहाँ पे तुम्हें दिख रहा है damaged vertebra, वहां पे दिखेगा white vertebra. White because more bone formation is occurring. So prostate cancer osteoblastic, breast cancer osteolytic. Which plexus of veins? Patterson. Which vertebra? Lumbar. No issues with this. ठीक है? Important वाले. A pregnant female was diagnosed with breast cancer. What is the treatment of choice? Jaldi. Pregnant female was diagnosed with breast cancer. What is the treatment of choice? Hormonal therapy and radiotherapy are absolutely contraindicated during pregnancy. They are absolutely contraindicated during pregnancy. Chemotherapy is contraindicated during first trimester. Chemotherapy is contraindicated during first trimester. So which treatment is absolutely contraindicated? Hormonal and radiotherapy during pregnancy. And which is contraindicated in first trimester? Chemotherapy. So what should be the treatment of choice? So in second or third trimester, you can perform a breast conservation surgery. Lactation भी तो करना है उस mother को यार. So you will perform a breast conservation surgery, either a lumpectomy or a quadrantectomy. Okay, एक lump या फिर quadrant निकाला जाएगा. That is what is a breast conservation surgery. कुछ breast tissue बाहर छोड़ा जाता है, right? So second and third trimester में what should be done? Breast conservation surgery. But as we all know, after breast conservation surgery, the chances of recurrence are very high, and therefore always the breast conservation surgery should be followed by. But in pregnant female, radiotherapy. So breast conservation surgery should be performed during which trimester? Breast conservation therapy should be performed during which trimester? But radiotherapy should be given. Radiotherapy should be given. Radiotherapy should be given after delivery. No issues with this. याद रखना. Then if I say, what is this histopathological examination showing you? Very good. It is showing you cells which are arranged one behind the other. This kind of arrangement of malignant cells is known as which pattern? Single file pattern or Indian file pattern. Single file pattern or an Indian file pattern is a feature of Indian file pattern is a feature of Indian file pattern is a feature of invasive file pattern is a feature of invasive lobular carcinoma. Indian file pattern is a feature of invasive lobular carcinoma. Indian file pattern is a feature of invasive lobular carcinoma. One lobular carcinoma has been removed from malignancy list. ये recent है. ठीक है? It is not a malignancy anymore. It is a benign tumor. And what is that? Lobular carcinoma in C2. So lobular carcinoma in C2 nowadays it is a lobular carcinoma in C2 is nowadays a याद रख लेना ये नया एडिशन है. ठीक है? Important. If I talk about breast conservation surgery, एक बार पूछा गया था, what is the margin of resection? Previously it was 1 centimeter, but nowadays it is only 1 millimeter. Nowadays it is only 1 millimeter. Recent update जो है वो बता रहा हूँ, ठीक है. Recommended is 1 centimeter, but recent update says it to be 1 millimeter. ठीक है, अगर recent update पूछा जाए तो 1 millimeter होना चाहिए. No issues with this anybody? Then if I talk about breast cancer, early invasive breast cancer कब बोलेंगे? Early invasive breast cancer means stage. So it is T1, T2, T1, T2, N0, N1, N0, N1, और फिर T3, N1, T3, N1. This can be counted as early invasive cancer. And what is the treatment of choice in early invasive cancer? Anybody? So the treatment of choice would be. So nowadays, definitely, if the patient is younger, we will not perform mastectomy. Nowadays, a better option available is breast conservation surgery. But breast conservation surgery should always be followed by. Breast conservation surgery should always be followed by. Or if the patient does not want recurrence, then therefore we will perform a. Simple mastectomy means only the breast tissue is being removed. Okay. Next, if I talk about locally advanced breast cancer, that means T3 or and N2 and above. So T3 and T4 or N2 and above are called as which type of breast cancer? Locally advanced breast cancer, LABC. Okay. Here the treatment of choice would be, first of all, but before that, we need to decrease the size of the tumor, and that is done by neoadjuvant chemotherapy. First, we will give new. So if chemotherapy is given prior to surgery, it is called as neoadjuvant chemotherapy. Followed by that, we will do a MRM. Modified radical mastectomy. MRM for modified radical mastectomy. Radical मतलब क्या निकाल दो उसके साथ? Along with breast tissue, the nipple areola complex, which was removed in simple mastectomy, in modified radical mastectomy, along with the breast tissue and the nipple areola complex, we will also remove the pectoralis major. तो यार निकाली जाती है usually Halstead's method, ठीक है, बाकियों में नहीं निकाली जाती MRM में. So MRM can be of various types. It can be Auchincloth, it can be PTs. So हर एक में नहीं निकाली जाती. So I would not say pectoralis major. Pectoralis minor, breast tissue along with nipple areola complex, and lastly axillary lymph node. Therefore it is termed as radical. जब lymph nodes निकालोगे, then it is termed as radical mastectomy. ठीक है. Followed by that you need to give radiotherapy. So early invasive breast cancer stages T1, T2, N0, N1, yeah, T3, N1. It is known as which cancer? Early invasive breast cancer. Treatment of choice is breast conservation surgery followed by radiotherapy. Low recurrence rate with simple mastectomy. Then locally advanced breast cancer is stage T3, T4 or nodal metastasis more than 2. Here the treatment of choice would be neoadjuvant chemotherapy followed by modified radical mastectomy followed by radiotherapy. ठीक है. So modified radical mastectomy जो बात आई है, it can be Auchincloth, it can be PTs also. ठीक है. बहुत टाइप की हो सकती है. It can be even Halstead's. In Halstead's we will remove pectoralis major. Whereas in PTs or the other ones we will remove only pectoralis minor. ठीक है. No issues with this. Lymph nodes are removed in radical mastectomy for sure. Okay. Minor is removed in all radical mastectomies. Breast tissue and the nipple areola complex is all. ER/PR positive अगर cancer होगा, for ER/PR positive in premenopausal females, the drug of choice would be. So if the breast cancer is ER/PR positive, that means hormonal therapy can be effective, and the drug of choice for premenopausal females would be chemotherapy. याद रखना, chemotherapy हम usually देते हैं, but ER/PR positive में हम hormonal therapy prefer करेंगे. ठीक है. ER/PR positive हो तो hormonal therapy. Chemotherapy देंगे, but बाद में देंगे. पहले hormonal therapy को prefer करेंगे. Premenopausal therapy, SERMs are given. What is given? So ER/PR positive premenopausal female, drug of choice are ER/PR positive premenopausal female, drug of choice are SERM is selective estrogen receptor modulator. And here these are drugs like tamoxifen, which has the high risk of endometrial cancer. So tamoxifen has a high risk of endometrial cancer. It decreases the risk of breast cancer, it decreases the risk of ovarian cancer, but it increases the risk of endometrial cancer. And therefore, a safer agent to be used is. Most common side effect of SERM are hot flushes. Most common side effect of HRT is. Then ERPR positive tumor in a post-menopausal female. The drug of choice would be aromatase inhibitor. Drugs like letrozole, anastrozole. HER2 new positive agar cancer या tumor. HER2 new positive के tumors में भी will give drugs like Herceptin, drug like Herceptin, और monoclonal antibody like trastuzumab. So HER2 new positive, Herceptin or trastuzumab or Herceptin or ERPR positive post-menopausal female, aromatase inhibitors like ERPR positive premenopausal female, selective estrogen receptor modulators like tamoxifen and raloxifene. Locally advanced breast tumor, chemotherapy, MRM, radiotherapy. Then if I say chemotherapy can be given in receptor positive patient, this chemotherapy usually nowadays is given with only 2 drugs, and those are pehle CAF या CMF regime use hota tha. Now the recent advances tell only 2 drugs, cyclophosphamide and adriamycin. Very good. ठीक है, cyclophosphamide and adriamycin. No issues with this, याद रख लेना. Then what is this? You can see over here. So it appears like eczema of the nipple, but it is actually not an eczema. It is a eczema-like inflammation. Very good. It is eczematous eruption of nipple. It is what? Eczematous eruption of the nipple. It is what? Eczematous eruption of nipple. And this is called as which disease? This is called as Paget disease. Is it a pre-malignant condition? Paget disease is a pre-malignant condition. Paget disease is actually an indicator of underlying malignancy. Paget disease is an indicator of underlying malignancy. अंदर कुछ tumor हो सकता है, but it is not palpable as such. ठीक है? And the Paget disease is an indicator of pre-malignancy. ठीक है? So Paget disease, investigation of choice would be true cut biopsy. And what is seen? नाम क्यों मिला है? Paget cells are seen. What is seen? What is seen on biopsy? What is the treatment of choice? Treatment of choices. So either first of all you will give drugs to the patient. ठीक है? Drugs like SERMs. Okay, drugs like SERMs can be given to the patient, or you need to treat the underlying malignancy or underlying cause. Okay, you need to treat the underlying cause or underlying malignancy. ठीक है, याद रखना. तो अगर वो ट्यूमर है तो डिपेंडिंग ऑन विच काइंड ऑफ ट्यूमर इट इज यू विल परफॉर्म. कोई भी सिंपल नहीं, कोई भी मैस्टेक्टमी कर सकते हो. ठीक है, तो याद रखना. नो इश्यूज विद दिस एनीबॉडी. लास्ट फॉर ब्रेस्ट है, इतना ही है. A 35-year-old lady presents with rapidly growing huge breast lump as given in the picture. Diagnosis is, the diagnosis over is phyloid tumor. Phyloid tumor is also called as cystosarcoma phyloid. Phyloid tumor is also called as cystosarcoma phyloid. So here you can see a massive breast tumor. Here you can see a. So if they ask you the largest breast tumor, it is phyloid. Largest breast tumor is phyloid. Along with that, due to pressure symptoms, there would be skin color changes. Which can cause pressure necrosis. Which can be due to pressure necrosis. समझ गए? Arteries दब जाएगी ना, so therefore it will cause skin color changes due to pressure necrosis along with a massive tumor. This is a CT scan which shows you a massive tumor like phyloid. Investigation of choice is a again FNSC or a true cut biopsy. Investigation of choice is a true cut biopsy or a FNSC. And treatment of choice is toilet mastectomy कर सकते हो. That is a wide local excision, wide local excision, or a simple तो ज्यादा बड़ा ट्यूमर है करके MRM मत मार्क करके आना. In fibrous tumor, the treatment of choice is wide local excision, and if it is very large in size, then it is simple mastectomy. Then if it is large in size, the treatment of choice is simple mastectomy. कोई दिक्कत नहीं है इसमें, easiest है ये तो. Then if there is presence of multiple nipples in the patient, it is called as polythelia. It is called as multiple nipple is. If there is presence of breast but absence of nipple, it is called as ootheria. Presence of breast but absence of nipple is called as that is what is breast development को क्या बोलते हो तुम puberty में? थैलार, इसीलिए बोलते हो थैलार. Then absence of breast is called as amasia or amastia. Absence of breast is called as amasia or amastia. ठीक है? And if there is absence of breast along with pectoralis major, it is called as Poland. Absence of breast with pectoralis major is called as Poland syndrome. Poland syndrome में क्या-क्या absent होता है? Breast and then here you can see the patient is having some dilated vessels which can be seen on the breast. This is usually due to superficial thrombophlebitis. Superficial thrombophlebitis. किस veins का? Superficial thrombophlebitis of chest vein. Superficial thrombophlebitis of these are usually inframammary veins. No issues with this. So superficial thrombophlebitis of chest veins or inframammary veins is known as which disease? This is known as which disease? Monder's disease. And when you palpate the vessels, they will feel like a cord or a string. Therefore, this is also known as string disease. Therefore, it is also known as string disease. No issues with this. Okay? Treatment is only analgesia. Reassurance and analgesia for pain relief can be given in this patient. Blood-stained nipple discharge. Diagnosis. Most common cause of blood-stained discharge is duct papilloma. Most common cause of blood-stained discharge is from single duct. If they give multiple duct, then the answer would be cancer. Most common cause of serous nipple discharge is physiological is definitely lactation. Okay, milk आता है. But most common cause of serous nipple discharge is fibrocystic disease. Okay, most common cause of serous discharge is fibrocystic disease. Most common cause of green, black or blue discharges. Most common cause of green, black or blue discharges. Ectasia means dilatation of the duct. So duct dilatation is called as duct ectasia. Treatment, what would be done? So if it is a duct papilloma arises in a single duct. So for duct papilloma, we will perform a microdocectomy. Duct papilloma के लिए the single duct will be removed. Duct papilloma के लिए. But for duct ectasia, it involves multiple ducts. Therefore, for duct ectasia, we will perform a conization surgery is performed. That is what is known as a Hadfield's operation. So Hadfield's operation is done for. Whereas microdocectomy is done for duct papilloma. If duct ectasia involves only single duct, then we can do a microdocectomy also. ठीक है? No issues with this. लास्ट ये कर लो फिर थायराइड है. अब ये इंपॉर्टेंट है. अगर एग्जॉस्टेड हो बस 2 सेकंड की सांस लो और देख लो. क्वेश्चन रिपीट आता है और सब गलतियां करते हो इस क्वेश्चन में, मुझे नहीं पता क्यों. A lady delivered a child 2 months ago. Now complains of pain and fullness in the breast. Child refuses to feed. Diagnosis and management is. The diagnosis in this condition is breast engorgement. Did I say any redness? Did I say any red warmth? Did I say any inflammatory sign, swelling? No, nothing, no fever. right? So therefore it is only breast engorgement. The cause is the child refusing the feed, and therefore there is accumulation of milk in the breast. August का question है, उसके पहले भी बहुत बार आ चुका है. Okay, accumulation of milk in the breast causes breast engorgement, and due to excess of milk in the breast there would be pain and fullness in the breast. So only of these two features are there, then the diagnosis would be breast engorgement. Along with these features, if I also mention about pain, along with fever, along with redness, shabash, it is mastitis. Then it is mastitis. ठीक है, mastitis. No issues with this. So याद रखना, pain, fever and redness. Here we will do mastitis. Here the diagnosis will be mastitis. Here the diagnosis would be mastitis. No issues with this. याद रखना. Along with this, if I add the patient is having fever with chills. Okay, here the patient is having fever with chills. That means it is a pyogenic inflammation. Along with that, I also add a fluctuant mass. I can also add a fluctuant mass. Then your diagnosis becomes. समझ गए फंडा? Pain and fullness. Pain, fever, redness. Fever with chills and a fluctuant mass. This is what a fluctuant mass will look like. Accumulation of pus in the cavity, and that is what is called as a breast abscess. ठीक है? So this is what is a fluctuant mass. What is seen in breast abscess? Fluctuant mass. What is the treatment? तो पहले तो ये बताओ, most common cause of mastitis. Most common cause of mastitis is Staphylococcus aureus, and most common source would be baby's mouth or baby's oropharynx. Most common source of organism would be. So this question also came. Most common source of infection in mastitis. The answer was baby's mouth or oropharynx. ठीक है? Important. No issues with this. Now drug of choice for mastitis. Anybody? Breast engorgement की management पूछे, पहले वो बता दो. For breast engorgement, the management would be. So breast engorgement के लिए the management should be pumps can be used, or maybe expression of milk can be done. Okay, so relief मिलेगा patient को after the milk is ejected out. ठीक है? So milk ejection should be done or milk expression should be done. ठीक है? So breast engorgement के लिए what we do? Milk expression with warm compresses. क्या use करोगे? और warm compresses would be used. ठीक है? No issues with this. Warm compresses for relief, and like milk expression will relieve the pain in the patient or fullness in the patient. ठीक है? If they ask you for mastitis, definitely it is infection. Therefore, the drug of choice would be IV or oral, depending on the extent. It is antibiotics. Which is the safest antibiotic? Lactating female, it is amoxicillin. Safest one is amoxicillin. And if the patient presents you with breast abscess, then the treatment would be direct incision or drainage करोगे. So two attempts should be made for ultrasound guided aspiration. If both of them fail, then you will do incision and drainage. If both of them fail, then you will do incision and drainage. So what is the treatment of choice for breast abscess? Ultrasound guided aspiration. What is the treatment of choice for breast abscess? Ultrasound guided aspiration. एक बार करा, वापस करो. दूसरी बार करा, अगर अभी भी वापस accumulation है, then now you will do incision and drainage. So how many attempts of ultrasound guided aspiration? 2. After that you will do incision and drainage along with antibiotics definitely in the patient. Then here you can see a mammographic picture which is showing what? Mammographic picture showing a popcorn calcification. It is suggestive of which tumor? It is suggestive of a benign breast tumor known as fibroadenoma breast. So fibroadenoma breast is malignant or benign nature? It is a benign tumor. More common in which age group? It is more common in 15 to 25. Most common in 15 to. The fibroadenoma most common age group for fibroadenoma is 15 to. If I talk about the histopathological examination, what is seen? So you can see that means the glandular spaces are compressed due to the malignant cells, and the fibrous stroma would be seen. What is seen? Fibrous stroma or compressed slit-like glandular spaces. This is known as which appearance? क्या? What's the flamingo? It is actually known as the. It looks like what? Horns of a reindeer or horns of a deer. उसकी तरह दिख रहे हैं ना वो fibrous septae. So it is a deer horn appearance or an antler appearance. It is called as which appearance? Which appearance? Which appearance? It resembles a deer horn or a reindeer horn. कैसे दिख रहे हैं ये? Septae, all of these glandular spaces. And fibroadenoma on palpation, it would be a firm tumor and it would be mobile. And therefore, as it is mobile, it is called as breast mouth. As it is mobile, it is called as breast mouth. What is the treatment of choice? Treatment would be observation and follow-up. Treatment would be observation and follow-up. When is actually fibroadenoma treated surgically? When is very good. If fibroadenoma is rapidly growing in size, first thing. If the fibroadenoma size is more than 5 centimeters, it is called a giant fibroadenoma. A question tha. When is fibroadenoma treated surgically? If the fibroadenoma size is more than 5 centimeters, that is called a giant fibroadenoma. No issues with this. Apart from that, if there is pain in the patient or for cosmetic purposes. Okay? With this, I end the session. I'll let you know the